I'm a board-certified allergist, and I treat patients with allergies, asthma, and clinical immunology problems like immune deficiencies. The scope of practice of allergy covers people with things like hives, frequent infections, itchy, sneezy eyes, nose, throat, a lot of coughing problems and asthma problems, chest problems related to their allergies. The Dallas-Fort Worth environment is very good at producing pollen, and we have probably more patients come in complaining of pollen allergies than any other type of allergy.
Prior to coming to Dr. Baxter, I tried several other things, but really I was doing self-medication, just pretty much living with what I was having to put up with, thinking this is just the way it is and I just have to deal with it.
Michael is a person who's had allergies pretty much all his life. They've been severe. He just wasn't able to stay well. He would have very frequent ear infections and basically stayed infected. I think his sinus infection never really cleared up. So we tested Michael. He is very, very, very allergic to just about every pollen that there is. And I remember his back was just very, very blown up with big reactions. And so to tackle that requires careful formulation of his immunotherapy and faithfully taking the shots for quite a long time to actually get the treatment up to the level that you need it to be to really give him protection.
If I have an infection or a cold or anything, I really don't even get that bad with those infections. So it just changes your whole lifestyle and your whole perspective on things.
His allergies were causing the frequent infections that he was having. And he's really not having those anymore now that he's taking his shots, and his shots have been able to be built up to a high dose.
My life changed a lot after having the shots because I went from having to take antibiotics once a month to about every 3 months, and then now it's the rare occasion that I have to come in and see Dr. Baxter for any infection medication.